MTA based. As you know, we developed MTA initially as a root end filling, and we tested it in dogs and monkeys. And what we showed was the fact that when you use this in dogs or cats or monkeys, like in this case, what you get is a layer of cementum growing over the root end and also the filling material that you have. And you have normal periodontal ligament and normal bone and no ankylosis. And when that happened, we said, okay, if it works in this area and this is something that seals well and it is biocompatible, then you can use it for other purposes. And they include vital pulp therapy, like, for pulp capping, apexification. In many of the regenerative endodontic cases, close to 85% of the cases, MTA has been used. Of course, the material has been used for repair of perforations and also root canal as a root canal filling material. Let's talk about pulp capping. There are many, many studies in the literature, animal studies and human studies, that have investigated MTA, and they have compared MTA with other materials. I'm going to just concentrate on these two briefly. This is a study that was done at Loma Linda by one of our former residents, Dr. David John, who practices in Tennessee, and he wanted to see what happens to the pulp after you use MTA or calcium hydroxide. So what he did was he created standardized size class 5 cavities. He exposed the pulps and they were also standardized. And then he either used calcium hydroxide, zinc phosphate cement, and amalgam, or he went ahead and filled the cavities with MTA. He looked at these teeth, or the reaction of these teeth to these procedures at 2 weeks, 4 weeks, and 8 weeks. This is what he observed in samples that were covered with MTA. This is where the MTA was, as you can see here. After even 2 years, you see a layer of dentin and actually no inflammation in here. And this is a higher magnification. As you can see here, there's no inflammation here, and there is a nice bridge after 2 weeks. Contrast that when he used calcium hydroxide, zinc phosphate, and also amalgam. As you can see here, this is where calcium hydroxide was. And as you can see here, there's not really a barrier there. And there is lots of inflammation here. If you go to higher magnification, the pulp is really, really inflamed. And this is what he showed in many of the cases that he observed. And when you look at these samples after 8 weeks, this is what you see. See here, when you use MTA, this is what you get. A nice thick layer of MTA, very little inflammation in here. This is another sample that shows presence of a nice layer of dentin, and the odontoblasts are lining up here, and no inflammation, or very, very little inflammation. Contrast that with calcium hydroxide after 8 weeks. Yeah, the animal has produced a layer of dentin. It's a lot thinner than what you see here, but when you look closely, the pulp is still inflamed. Based on what he did, he concluded that when you use MTA, it produces faster calcific barrier formation. And also, this barrier is a lot thicker than what you see when you get or when you use calcium hydroxide.